What is hormone therapy? Hormones are substances produced by our bodies that perform specific tasks. For example, female and male sex hormones. Hormones are produced by a number of organs and tissues, such as the thyroid, testes, and ovaries, and are secreted into the blood. Hormones give off signals, and as such, they influence other organs or processes in our body. For example, the sex hormones in women cause the growth and development of breasts. If a tumor develops here, the cancer cells, like the healthy cells, will often depend, in part, on the presence of these sex hormones. This is referred to as hormone-sensitive breast cancer. As long as there are hormones, the cancer cells can continue to divide, and the tumor will continue to grow. In the absence of hormones, the cancer cell growth decreases. Hormone-sensitive or hormone-dependent tumors are thus characterized by the presence of cancer cells that start dividing in the presence of certain hormones. The growth of breast or uterine cancer in women can be stimulated by the presence of estrogen, a female hormone. In men with prostate cancer, a similar phenomenon is observed. In that case, testosterone, a male hormone, stimulates the growth of the cancer cells. To determine whether a cancer is hormone sensitive, the presence of hormone receptors on the cancer cells is examined in a piece of tumor tissue obtained by biopsy or from the tumor itself that has been surgically removed. Biopsy is explained in a separate video. If a tumor is indeed hormone sensitive, specific drugs are prescribed that inhibit, block, or deactivate the hormones. As such, hormone therapy is actually an anti-hormonal treatment, as it aims to stop the stimulation of the tumor by hormones. There are two ways of doing this, either by blocking the production of the hormones themselves, or by switching off the receptors that recognize hormones. These anti-hormonal treatments are often given over a long period of time. The treatment can last from several months to several years, often 5 to 10 years, and is usually administered by mouth. Administration by injection or a combination of the two is also possible. Like any therapy, anti-hormonal therapy also has side effects. The possible side effects are reminiscent of the typical symptoms of menopause: hot flushes, excessive sweating, joint pain, weight gain, mood changes, insomnia, loss of concentration, and fatigue. Men may experience these side effects too. The symptoms vary from person to person. Anti-hormonal therapy can cause women to experience vaginal changes, such as vaginal dryness. Men may experience erectile dysfunction. A decreased libido is another possible side effect. This may have several causes. Anti-hormonal therapy can sometimes cause osteoporosis or brittle bones. Some simple tips can alleviate these side effects. If these are not effective, another anti-hormonal therapy is sometimes prescribed. It is therefore very important to discuss your symptoms with your care team. If you have any other questions about this topic, do not hesitate to get in touch with your healthcare providers at the hospital.